Yeah, so the hashtag "This is our shot" was more or less born out of the idea that we as healthcare workers can do something and should be doing something to combat the vaccine misinformation, disinformation, and hesitancy that were kind of prevailing the conversation, kind of taking over the conversation, preventing folks from getting access to the right information, making things worse potentially as far as our ability to combat this public health disaster. So we felt as clinicians, not only have a duty to take care of our patients at the bedside, but we have a duty and an obligation to do more outside of the hospital, outside of the medical clinics. The fact is, the community is recognizing that we're failing to meet some populations, specific populations that are incredibly high at risk. Black and brown populations, for example, are much more high risk for contracting this virus and having much more lethal consequences from it. And I think we're seeing the community kind of realizing that, and community stepping up and trying to reach out to those folks directly. And that's what makes it such a great experience to see as society is evolving, as we're trying to finding out these missing gaps, these pieces where we can't get folks vaccinated. Society is stepping in with mobile vaccination clinics, reaching out directly to those populations. I think as we see more and more of that, as supply increases, I think you're going to start to see more and more of that. And hopefully we'll see us start to really break down those numbers of those resistant populations for whatever reason, whether it's access, not enough time, not enough trust, whatever it might be. Hopefully we can kind of break down those barriers and get those folks vaccinated.
I think it's important for so many of these communities to address the trust issue first and to say, hey, we know that there's this history. I think in Black and brown communities, it's to say, we know that systemic racism exists. We know that it still exists. It happened. We know about Henrietta Lacks. We know about the Tuskegee experiment. We acknowledge that that happened. We also acknowledge that there are things that we need to do better. And we know that COVID-19 has really blown up and shown, with these disparities with COVID-19 that reflect other disparities for these communities. But this is where we as a health community and a healthcare community can stand in the gap.
What's really clear, and what we've been telling our community and coalition on This Is Our Shot, is that this issue, the work and the study around vaccines has been in play for a long time. Coronavirus were first researched in the 1960s, 80 years ago. Success in the mRNA platform, so-called new technology, was first published in the prestigious journal Science in the 1990s. That's 31 years ago. Mm-hmm. The largest wealth of scientific knowledge on the inner workings of coronavirus happened during SARS 18 years ago. And so after hundreds of years of scientific advancement and the fact that these vaccines went through the same process of rigorous review through the FDA and other bodies than any other vaccine we've put forth, we have 3 highly effective and safe vaccines that prevent hospitalization and death. So take the one you can get and do it quickly, because there are also variants and other things at play, that might become a problem.
The fact of the matter is that I think this is why PLS was created, for society's leaders to come together and chat and try to tackle these phenomenal challenges facing our society, facing our country, facing the world. So in a lot of ways, I think PLS prepared us for this moment. And I feel like we all feel compelled to try to do whatever it is we can do to make a difference. And I think PLS has armed us with the ability to make a difference.
And all throughout this past year, PLS alumni and the PLS community have shown up time and time again in different ways, from technology to manufacturing to how do you community organize, to community partners they have, to funding, and just to push you on your own thinking about certain issues, to challenge you on that so that you get to the best place. It doesn't matter that they may come from a different background or experience, but you can have that dialogue because of that experience and shared experience, that we've had together through PLS, and a recognition of that, in diversity can come strength and power to make a big difference around these challenging, vexing problems that require cross-sector collaboration. And President Bush, President Clinton, have just shown their leadership by example, along with the whole PLS team throughout this past year. And we've seen stories of this through our alumni webinars and other conversations. So it's just been incredible to draw upon the lessons. And I don't think we could have made the impact, together that we've been able to drive forward if it had not been for PLS.